Welcome to the Week 2 video lecture. The dilemmas presented in Chapter 1, What is Morality, are pretty serious. In fact, they're quite literally matters of life and death. Moral theories are especially important for thinking about these kinds of choices, especially when there isn't familiar protocol or norms for dealing with those kinds of choices. But, and I just want to make this point before we get started, moral theories are also relevant to everyday, ordinary choices too. For instance, should I spend this $5 on myself, or should I donate it to charity? Or, should I keep my promise? Those kinds of questions. It just so happens that these more extreme and graphic examples are the ones that Rachel is discussing in Chapter 1. The first case that Rachel discusses is that of baby Teresa. Baby Teresa was born with anencephaly. She was born without her brain. However, she still had a heartbeat and the ability to breathe. What makes baby Teresa's case so peculiar is baby Teresa's parents' request that her organs be volunteered for immediate transplant after birth. This means that baby Teresa would be killed in order to use the organs for other patients. The second case is that of Mary and Jody. Rachel's discussion begins on page 6. Mary and Jody were conjoined twins. Their spines were fused together. They shared a heart and one set of lungs. Doctors said that without intervention or a surgery, Mary and Jody would both die within 6 months. They could perform an operation to save Jody, but Mary would die as a result. Mary and Jody's parents were opposed to the operation on the grounds that they were devout Catholics and felt that they didn't want to be responsible for Mary's death. The doctors petitioned and operated anyway, with Mary dying as a result. However, they did manage to save Jody. As Rachel points out, it's easy to get sidetracked in this case. While there is an important question about who should make the decision to operate, the real question is whether the operation should be performed. The third and final case from Chapter 1 is the case of Tracy Latimer. Tracy Latimer was 12 years old when she was killed. She suffered from cerebral palsy. Rachel describes her as being less than 40 pounds and as having the mental state of a 3-month-old baby. Tracy Latimer was killed by her father, Robert Latimer. What's interesting about the case is that the jury seemed to take sympathy for Robert Latimer. They seemed to recognize him as being motivated by ending Tracy's suffering rather than being motivated by any malicious motivations or intent. What we want to focus on here is not whether Robert did something legal or illegal, but whether he did the right thing. Each of these cases are interesting to consider on their own, but there's a key theme that runs through each one, and that is the question of whether it is okay to kill another human being. And this is the question that we're going to approach as we read this chapter as moral philosophers. Given the circumstances, given what was at stake in each case, was it okay to end the life of another human being? Let's take another look at those cases. Again, the dilemma is whether it is okay to kill another human being. In the case of baby Teresa, we have to ask, is it okay to kill another human being if it will benefit other people? Since the killing of baby Teresa will directly lead to the benefit of people who receive her organs. Then, the case of Jody and Mary. Is it okay to kill off another human being if it will save another human being's life? Is it okay to let Mary die in order to save Jody? And then, in the case of Tracy Latimer. The case of Tracy Latimer. Is it okay to kill another human being if it will end or decrease the suffering of that human being? Following each of the cases, we get a series of possible justifications for the actions performed in each case. For example, in the case of baby Teresa, we have a series of paragraphs following that case with a justification in each paragraph for the actions performed. So, after baby Teresa, we get this paragraph titled the benefits argument. And this is an argument justifying the actions of baby Teresa's parents to harvest her organs, based on the benefit it would bring to other people. This is an example of moral philosophy. This is what moral philosophers do. They think about right and wrong in each case, and they try to provide reasons or what's called justification for why those actions are right or wrong. Following Rachel's discussion of the 3 cases, we get this discussion of the relevance of our feelings to moral philosophy. It might seem to us that our feelings are relevant to right and wrong, We've all had that bad feeling about something we shouldn't have done, or felt the emotional weight of regret after we do something wrong. But actually, feelings have absolutely nothing to do with ethics. That is, how we feel about an action has nothing to do with whether the action is right or wrong. And Rachel's gives us two arguments for this. The first is that feelings are irrational. The first premise is that feelings may be irrational because they're based on prejudice, selfishness, cultural codes. In other words, they're just based on false beliefs. And then, if something is irrational, then it can't be counted as reliable evidence. The conclusion to this argument is that feelings are not good evidence for our moral claims. Are any of you familiar with any of the true crime shows or podcasts that have become so popular recently? Netflix Making of a Murderer, or the Serial podcasts? Well, a key theme in each of these shows or podcasts it can be found in this argument, and that is that our feelings about a case, or the feelings of the jurors, have absolutely nothing to do with the truth. Somebody might feel that Stephen Avery or Asit is guilty, but that has nothing to do with whether they actually committed the crimes. Likewise, we might feel that they're innocent. That again has nothing to do with whether they actually committed the crimes. In a similar way, how we feel towards a specific situation or choice has no bearing on whether it's right or wrong. Because those feelings could be based on false beliefs. They could be based on prejudice, selfishness, cultural codes, or any number of other false beliefs. Rachel's second argument is the argument that feelings vary from person to person. The first premise is that an action is either right or wrong. There's nothing else that actions can be, and they cannot be both right and wrong. The second premise is that people's feelings vary towards actions, so some people might feel that an action is right, and other people might feel that an action is wrong. Consider the case of Tracy Latimer. Some people might feel that Tracy Latimer's father did the right thing, and other people might have deep feelings of resentment or think that he did the wrong thing. If feelings determined right and wrong, and some people felt that he did the right thing and some people felt he did the wrong thing, then it would turn out that the action would be both right and wrong. And since actions can't be right and wrong, it follows that actions cannot be determined by feelings. Or rather, the rightness or the wrongness of an action cannot be determined by feelings. This concludes the Week 2 video lecture. Please make sure that you complete the discussion forum posts. You need to write 2 separate 100-word posts, that you complete the content quiz, and that you also complete your first short response assignments. I posted that already into the Week 2 Moodle. Thank you very much, and I'll see you next week.